Provinces now. More vaccines, that's what the Western Cape wants. It's had to temporarily close some of its vaccination centres because they simply don't have enough doses to keep them running. So how is the province managing to beat its vaccination targets? Lindsay Dentlinger finds out.
It was devastating Thursday and Friday last week. We've got 65 sites open in the city of Cape Town. We've got 107 sites open across our rural areas, and especially some of the far-flung rural areas, we had to close down some of those sites on Thursday and Friday because of the supply of vaccines.
Not an ideal situation to be in while in the throes of a pandemic, but the Western Cape is forging ahead. The province's 33rd private vaccination site opened its doors on Monday. It plans to vaccinate 1,400 people a day. But if the vaccine keeps flowing, it says it can ramp that number up to over 3,000 a day.
The biggest thing is, for me, have we got enough vaccine? So we've got to have the supply of vaccines coming because we are ramping up over the next 2 weeks. We are ramping up to 207 sites across rural areas, 70 here in the city, and that's only public sites.
The province is still at the beginning stages of a third wave, but says its system is well primed for a potential onslaught in infections.
The pressure on the system is going to be exponentially bigger every single day, but at the end of the day, the system is designed to cope. We've just got to make sure there's a flow of vaccines.
But how is the province managing to balance competing demands while others are struggling?
There's some things in the Western Cape that I think they've done particularly well, which is let's try and take away the bureaucracy, and let's realize that we're in a pandemic and that we have to put the patient at the center of our response. And so in doing that, let's figure out how we use technology. How do we repurpose facilities to become health sites? Because what this does is it's not only more convenient for the patient, but it takes the pressure off the health system.
Bray says stable leadership and long-serving health specialists are also making the difference in the management of the pandemic in this province.
Other provinces have had challenges as leadership have come in and come out for a host of different reasons. I think it's really challenging in the middle of a pandemic to have all of the other parts moving and then not to have the leadership anchor to really see through pandemic times.
The province hopes to have 3 mega vaccine sites fully operational by next month, but it will need more than 1.6 million doses to inoculate the next eligible age category. Lindsay Dentlinger, Cape Town.